What happens when schizophrenia treatment fails? What happens when treatment for schizophrenia does not work? This is a pressing question for many. When treatment fails, the symptoms of schizophrenia can continue or even worsen. This includes hallucinations, delusions, and disorganized thinking. It can also involve negative symptoms like social withdrawal and lack of motivation. This situation is often referred to as treatment-resistant schizophrenia. It is defined by a lack of improvement after trying at least 2 different antipsychotic medications for a sufficient time. The consequences of treatment failure can be serious. One major outcome is an increased risk of relapse and hospitalization. Patients who do not stick to their medication or whose treatment is ineffective are at a much higher risk of experiencing a psychotic relapse. This often leads to longer and more frequent hospital stays. Studies show that non-adherence and treatment failure are closely linked to worsening clinical outcomes, including a higher risk of suicide. Another outcome is the worsening of symptoms and functional decline. When treatment does not work, positive symptoms like hallucinations and delusions can persist or worsen. Negative symptoms such as apathy and social withdrawal can also continue, making everyday life more challenging. This can lead to difficulties in maintaining relationships, holding down a job, and living independently. Those with treatment-resistant schizophrenia may face long-term disability and a lower quality of life. There are also higher healthcare costs associated with treatment failure. Cases that do not respond to treatment can impose a much greater financial burden on healthcare systems. This is due to the need for more intensive care, repeated hospitalizations, and additional supportive services. Sometimes, treatment failure is linked to issues with medication. For example, Clozapine is an effective option for treatment-resistant schizophrenia but is often underused due to its side effects and monitoring requirements. If Clozapine is not managed properly, it can lead to severe rebound psychosis, which may result in dangerous behaviors or even confrontations with law enforcement. Furthermore, individuals facing treatment failure often struggle with social and personal milestones. They may have lower rates of marriage, higher rates of institutional living, and poorer social integration. Ongoing symptoms can interfere with achieving life goals that contribute to a fulfilling existence. When treatment fails, it is essential to reassess the diagnosis and explore alternative medications, including Clozapine. Integrated approaches that combine psychosocial interventions and therapy can also be beneficial. Close monitoring for medication adherence and side effects is vital to avoid further complications. Identifying treatment resistance early can help tailor more effective strategies to improve outcomes. Despite the challenges, it is important to note that schizophrenia is not untreatable. Many patients respond well to treatment. For those who do not, ongoing efforts are necessary to prevent deterioration and support recovery.